What's up, everybody? I am Doc John from Mobility Doc, and I'm going to talk to you today about tightness. Why does it matter? So many of our patients, of our subscribers, so many people say to us, I've been tight my whole life. Why does it matter? How is it affecting me? How could it affect me in the long run? And what is too tight? Like, at what point does it even matter? So what we're gonna tackle, why tightness matters, what is muscle tightness exactly, what causes it, how it affects the body, common examples of muscle tightness to just kind of get you thinking about it a little bit and how it might relate to you. But we're also going to get into how to fix it, because most importantly, this channel exists because we are trying to teach you how to take care of yourselves and how to never stop doing the things that you love to do. Our overarching goal is to contribute to and possibly inspire a culture of movement. So we don't want you to quit. You shouldn't quit. Don't listen to the haters. Keep on going. So without further ado, let's get into why tightness matters. Flexibility and strength is what determines good movement, and it helps to make sure you don't get injured. So flexibility in and of itself speaks to muscle tightness. The more tight you are, the more likely you are to have an increase of pain, an increase in just overall stiffness, and a decrease of overall mobility or range of motion. And some of that might sound kind of obvious, right? If I'm tight, I probably am gonna be stiff. If I'm tight, I'm gonna lack some mobility. But if we remember from previous videos, we've gotten into this idea of mobility, for example. Mobility speaks to flexibility, stability, and strength. So if you are tight, what I'm saying is not just that you're going to be stiff, but you're going to be affecting your ability to be strong, to be flexible, and to be stable. You need the right amount of tightness to have the right amount of flexibility, stability, and strength. So what is a tight muscle? Most specifically, a tight muscle is a muscle that has gone through a change in the length of the muscle fibers. There are two types. There is active. Active is contracting and relaxing. It is that bicep curl, that leg curl. It is taking a muscle through a range of motion, right? What we are trying to get at the heart of is passive tightness. Over time, it develops. It is caused by posture. It naturally decreases the length and flexibility of the muscle itself. So over time, we've reinforced what its job is, what its need is, what we're requiring from it. So if we sit at an office chair all day, kind of hunched over time, we are teaching our body, our muscles specifically, to maintain and meet that need of being in that position. So passively, over time, we have postural changes, and it decreases the natural length and flexibility of our muscles. Something I'm not going to get really into too is you start to have like neural habituation. So you're even like your brain is part of this, right? Like your brain is now learning like, oh, okay, in my case, John, right? So John doesn't actually need for me to be back here. He needs for me to be here. So I'm going to downregulate all of that signal. It's going to tell the muscle that, okay, this is your new tone. This is your new resting length. This is your new normal. I got ahead of myself a little bit, but there are different things that cause it, not just posture, right? So I've used this more recently when recording, but the inactivity, if you don't use it, you lose it. Like when I used to compete at a relatively high level in Olympic weightlifting. I haven't done that in a little bit of time now. So my best overhead squat was 315 pounds when I weighed 170 pounds. A fairly decent overhead squat, right? I can't do that now, not just because I don't have the strength anymore because I haven't been doing that exercise, but I haven't reinforced my need for it. So now my shoulders just don't want to like be up here with 315 pounds on a barbell overhead. That sort of inactivity as well, just the lack of use in a specific way. Repetitive motion can also cause muscle tightness, and if it's not kept in check, will again tell your brain that like we need to increase the resting tone of the muscle, and you might need it for a moment, but you don't want it for forever. And if you don't do mobility work, what'll happen is it'll lead to a larger imbalance, which will potentially lead to injury. A good example is, I'm gonna shout out to Rudy Winkler here, because Rudy came to me as already a two-time Olympian saying, hey, I need some way to balance myself out so that way I can remain healthy. He also needed a way to be able to warm up, a good mobility routine of flexibility, strength, and stability that could get him to be ready to throw his hammer, because he is the American record holder for the hammer, now three-time Olympian. It crushed it at the last Olympics. He needed that ability and needed to keep his muscles to have the right amount of tension, but not an unhealthy amount of tension. And he's been doing a thing that's very specific for a very long time. And when you do a thing that's very specific enough, you start developing the compensations. So repetition of motion, like in running, cycling, throwing, if you don't keep that in check, that changes your posture over time because you form into it a little too much. But you also can then form muscular imbalances, which is can lead to weakness from reciprocal inhibition. So if one part of you becomes too strong, another part of you might start to become functionally weak. It just can't do its job. You're so strong in your bench press and you neglected your back. So now your back's really weak because it has to fight all of that muscle tone in your chest, right? So you get weakness and then you get compensation. And compensation can create also chronic tension, and that chronic tension, say from just blowing up a big bench press but not balancing it, can create shortening in the muscles in the front of your body. Another common one is weak glutes caused from tight hamstrings. If you aren't on top of your hamstrings, they can overtake your glutes. But also you can get the other way around, where if you don't focus on your glute strength enough, your hamstring might actually have to act like your glute. The fourth and final one that I wanted to get into was injury or scar tissue buildup. Scar tissue can be from a surgery or also can be from an injury. We got into that in another film, which we can put somewhere here. But basically, injury can also create shortening in the fascia, in the connective tissue around the muscle. It can also create muscle guarding, because once you've injured yourself, you kind of keep everything a little tight. A lot of people with rotator cuff injuries start keeping their shoulder a little bit more forward, start overusing their upper trap, start overusing their pec, their bicep, and they stop using their shoulder, rotator cuff and adjacent muscles, and overcompensate. How does this affect the body? I've kind of said some of this because I get excited while talking about it, but how it affects the body is muscle tightness will lead to a decrease of range of motion, an increase of pain. It'll lead to an increase of risk of injury, because the tighter your muscles are, the less resilient they are, the easier it is for you to have a strain, the easier it is for you to develop inflammation. And then also you get compensation, which we've spoken about a bunch of times. If you have a wrist injury or a grip issue, you also start overusing other parts like your bicep or your shoulder. But basically, when you get tightness in one area from any of the 3 or 4, I said, different ways that you can cause muscle tightness, but you continue to do the thing that you love to do, if you don't address that tightness, those 4 types of tightness, then you basically are putting yourself out there for compensation and injury and pain. To get into some of these common examples again, common areas are your hamstrings. We have these different videos we've already made on YouTube for these areas, which we're going to share with you right now as I'm speaking. But if you have tight hamstrings, you're going to affect hip hinging, level changing. It's going to be hard for our runners, our power lifters, our Olympic weightlifters, our jiu-jitsu athletes. Like if you want to be able to roll freely and smoothly, you're going to need to get on top of some amount of hamstring. It's going to really be hard for you to be comfortable in guard position if your hamstrings are tight. Chest, right, is a big one because we're also like forward dominant. You eat this way, you work this way, like you drive this way. A lot of our life is lived forward, so you need to balance that out. Forward head posture is a big one, right? Neck pain comes from this. And then calves are a really big one. A lot of us have like really tight calves, and those tight calves mess with our ankle mobility, which if you're a runner is going to create a whole host of issues locally at like your Achilles tendon, your plantar fascia, but then also in your natural gait and how you're running. So I've said a lot. How do we fix it? Posture is going to be a big one. If you are someone who has been discounting why it's important to have good ergonomics or good posture, or just switch up your posture through the day, I hope I've made my point. Change it up. It's very actionable. It can be sometimes easy to forget the need to do that, and sometimes it can be hard if you're, say, like a new parent. You might be caring for a small child, an infant, a toddler. You need to focus on then like strengthening, right? So that is one of the other things you can do is you want to balance out those parts you're overusing by improving the strength in the opposite motion. So that's like that old split of push or pull, right? So like you want to make sure you balance out, for example, all that pushing with pulling and vice versa. Those people who do really repetitive singular tasks, you want to think about those other muscles that you're neglecting. But you also want to continue to strengthen those muscles that you're demanding a lot from. Mobility work is where a lot of this falls under. We have our MDRx programs, which focus on flexibility, stability, and strength through our different parts of your body. We also have really good YouTube videos that we've already made for, 10-minute fixes for hip mobility, for low back mobility, for spine mobility generally, for shoulder. We have all that there for you already nice and free. And then if you have a good strengthening routine, obviously, right? Getting back into the gym. If you need some extra help and have questions about that, you can even ask us about our online MD Fit program, which is a 4-week monthly program that we continue to change every single month that you can subscribe to if you want. We'll leave a link down at the bottom, but it's a really great way. I program for it personally, and I'm constantly thinking, how do I balance out my pressing, my pulling, my level changing, my hip hinging? How do I keep my spine, my shoulders, my hips, and everything in between balanced? That's what our MD Online is all about. Manual therapy, last but not least manual therapy, if you have a good body worker or a good PT, a place like Mobility Doc, where they specialize in manual therapy, every so often it's not a bad idea to get some outside help to make sure that the parts that are hard to get to or you might have missed that we get. But also, this is a lot on you. There's like manual therapy, self-myofascial release. That's why we're going to continue to loop in our videos on muscle flossing, muscle scraping, foam rolling. These tools and these ideas are like tantamount to you maintaining good muscle tone, not getting too tight, but having the right amount of tightness. And we see it every single day here. We just see people constantly getting better, constantly getting back to the things that they love doing, that they thought they couldn't do, but just needed to know how to go about it. So I hope that you found this video to be helpful. Thank you if you listened to me all the way to the end. We're going to continue to make more videos like this. Remember to like, share, comment, subscribe if you haven't already. Let us know what you want from us. We're always open to good feedback. If something was confusing or if you have more questions, we can deep dive. That's also why we have our Instagram. That's also why we have our Substack now, so we can nerd out a little bit more with good detail, but our YouTube community is a good place for that as well. We're happy to nerd out wherever you want. Ask us questions. I'm Doc John from Mobility Doc. Thanks for watching.